This quick guide on treatment for relapsed and refractory multiple myeloma will cover what is relapsed and refractory multiple myeloma, treatment options such as immunomodulatory drugs, proteasome inhibitors, monoclonal antibodies, chemotherapy, histone deacetylase inhibitors, steroids, stem cell transplant, maintenance therapy, clinical trials, and an overview of symptoms and side effects and coping and support.
Let's talk about relapsed and refractory multiple myeloma. Relapsed multiple myeloma is when the cancer returns after a period of remission, when you have no symptoms or any signs that the multiple myeloma is coming back. This is very common for multiple myeloma. A second period of remission after more treatment is also possible. Most often, a combination of different anti-myeloma drugs are used to treat relapsed myeloma. Refractory multiple myeloma is when the cancer does not go away with treatment. Often, if the first treatment regimen doesn't work, another entire treatment regimen will be tried. The same types of treatment are available for refractory myeloma as are available for relapsed myeloma, but different regimens will be tried than before.
Treatment offered after relapse depends on several things: disease-related symptoms, the risk of another relapse, your general health, past treatments, and how well past treatments worked.
There have been a number of new treatments for multiple myeloma that have been proven to work well in recent clinical trials. All people living with multiple myeloma at any stage should ask their healthcare team if there are any clinical trials they should consider as a treatment option for them. A clinical trial is a research study to test new treatments or learn how to use current treatments better. Ask your healthcare team if there is a clinical trial that is right for you. Clinical trials study new promising treatments like CAR T-cell therapy, as well as how to use current treatments more effectively. You can learn more about clinical trials on the Cancer Support Community's website at www.cancersupportcommunity.org/clinical-trials.
There are many different options for treating multiple myeloma. Your doctor should recommend a treatment plan customized for you, your goals, and your preferences. Most treatments use a combination of drugs at one time. Your healthcare team will most likely use different treatments throughout your treatment journey. If you have symptoms, supportive care like bone strengthening, growth factors to increase low blood counts, or kidney care can also play a role. This quick guide walks through the treatment options you may be offered depending on your diagnosis. Unlike with other cancers, with multiple myeloma, you can reuse a drug or drug combinations over time. The drug types for this cancer include immunomodulatory drugs, proteasome inhibitors, monoclonal antibodies, chemotherapy, histone deacetylase inhibitors, also known as HDAC inhibitors, and steroids.
Immunomodulatory drugs help the immune system find and attack multiple myeloma cells. These drugs are taken as a pill. Both Revlimid and Pomalyst are given in combination with other drugs to treat relapsed or refractory myeloma. People taking these drugs are often given blood thinners or aspirin to prevent blood clots. New immunomodulatory drugs are being developed and tested in clinical trials.
Proteasome inhibitors cause multiple myeloma cells to die. These drugs are either given as a pill, intravenously, or as a shot under the skin. Velcade, Kyprolis, and Ninlaro are often given in combination with other kinds of drugs to treat relapsed or refractory myeloma.
Monoclonal antibodies are made to attach to specific proteins on cancer cells. They help your immune system find and destroy multiple myeloma cells. These drugs are given by IV. Darzalex or Implacidi are often given in combination with other kinds of drugs as treatment for relapsed or refractory myeloma.
Chemotherapy kills fast-growing cancer cells. Unfortunately, it also kills fast-growing healthy cells, which causes unwanted side effects. Chemotherapy is given as pills or IV drugs. Chemotherapy is sometimes given in combination with other drugs for multiple myeloma that has already had at least one treatment.
Histone deacetylase inhibitors, HDAC inhibitors, are most often given to patients whose myeloma is relapsed, which means it has returned after treatment, or to patients whose myeloma is refractory, which means the cancer doesn't respond to other treatments. It is given as a pill.
Steroids in high doses are used to trigger the death of multiple myeloma cells. They can treat inflammation or swelling. Steroids can also decrease some side effects like nausea and vomiting from chemotherapy. For multiple myeloma, steroids are most often given as pills or by IV. Steroids can cause problems sleeping and mood swings. Let your healthcare team know if this happens to you. Steroids are often given in combination with other drugs for treatment of relapsed or refractory multiple myeloma.
Another treatment option for myeloma is a stem cell transplant. This is not a surgery. It is an infusion of blood-forming cells, stem cells. It allows your healthcare team to use higher dose chemotherapy to kill multiple myeloma cells than would otherwise be safe. This type of treatment can lead to a long remission. It can even be done more than once after relapse. There are two types of stem cell transplants. An autologous or auto transplant uses your own stem cells, or an allogeneic or allotransplant uses healthy stem cells from a family member or matching donor. An autologous or auto stem cell transplant is most often used for multiple myeloma. To learn more about stem cell transplants, visit www.cancersupportcommunity.org/SCT.
Maintenance therapy is given to patients whose cancer responds well to treatment and can prevent the cancer from returning. You'll have routine tests done to keep track of how you're doing. Immunomodulatory drugs are commonly used for maintenance therapy. Sometimes proteasome inhibitors are used.
For all patients with relapsed or refractory multiple myeloma, supportive or palliative care, like radiation to reduce bone pain, growth factors to increase low blood counts, or kidney care, can help relieve symptoms caused by your disease. Supportive or palliative care can also help manage side effects from treatment, including nausea, vomiting, and constipation. To learn more about symptoms and side effects and tips for coping, see our quick guide to coping with symptoms and side effects of multiple myeloma.
Treatment for multiple myeloma can be expensive. You can learn tips for managing and coping with the cost of your care on the Cancer Support Community website at www.cancersupportcommunity.org/cost.
Having your myeloma return or not respond to treatment, needing ongoing and repeated treatments, and/or changes to your body caused by treatment can cause anxiety, sadness, depression, or frustration. Tell your healthcare team if you are having these feelings. Many forms of support are available. People find individual counseling and support groups help them manage these feelings. These can be online or in person. Connect with your loved ones and your community to help you through treatment or other tough times. One way to do this is through CSC's mylifeline.org. Some also explore other activities, such as meditation or yoga, or talking one-on-one with an oncology social worker, therapist, or spiritual advisor. You can also call the Cancer Support Community's helpline at 888-793-9355. This is the end of this quick guide to treatment of relapsed and refractory multiple myeloma. To learn more about multiple myeloma, go to www.cancersupportcommunity.org/multiple-myeloma.